my name is Master Sgt. Jackie Marshall. I'm with State Public Affairs, and today I will be speaking with a soldier who recently received the COVID-19 vaccine. The Wyoming National Guard wants to educate and make sure soldiers and airmen are receiving the facts about the vaccine. And we also want to clear up any misinformation that folks may be hearing about the vaccine. And we'll continue to do that with a series of updates like this through social media. So please stay tuned to our Facebook page. So I'm speaking today with Staff Sgt. Nolan Budweg. Thank you for being here today.
Thanks for having me.
Just to give everyone a little bit of background about Staff Sgt. Budwig, he joined the Army National Guard in 2010 with the 34th Army Band, and he is now with the 67th Army Band. He's a drum major of the ceremonial band, and his primary instrument is the French horn for the concert band, but he also plays the keyboard and sings vocal while he jams with the Army rock band. That's pretty awesome. And so on the other side, on Nolan's civilian career, he takes to the skies as a flight attendant. And he's been with United Airlines since 2016. And if that wasn't impressive enough, he's currently in graduate school, and he's studying to earn a Master's of Science in Biotechnology, focusing in biosecurity and biodefense. So that's pretty amazing that you're doing that while doing a civilian job, while doing this as well that you're doing. And so just for folks that may not know, back in October, the Wyoming Army and Air National Guard were activated by the governor to assist the Wyoming Department of Health with administrative tasks and volunteer with COVID-19 contact tracing. So Nolan, you've been leading a team of 10 soldiers currently in Gillette. Tell me about this mission.
So we are in two facilities here in Gillette. We're at the Campbell County Memorial Hospital, and then also the Legacy Living and Long-Term Care Facility. So we have 10 soldiers, and we do a number of different jobs. My job is primarily security and screening. So I work at the main entrance here at the hospital, and we basically have everyone who comes into the hospital, we ask them questions such as if they have any signs or symptoms, if they've ever tested positive, if they've been asked to quarantine, and we get them screened in so that the hospital can keep track of everyone who's coming in. And then we also have soldiers who are in housekeeping, laundry, testing staff members, and doing a number of different jobs that basically we're helping the hospital staff when they need to go out in quarantine and when they're sick to backfill these positions so that the hospital can stay running.
Oh, that's awesome. So you're relieving a lot of stress for them.
Definitely.
So that's awesome. I bet it really feels good then to be part of this mission.
Yes, and everyone, the staff, all the patients, the community, they're very appreciative of us being here.
So can you share a little bit, well, actually you did already talk about this, but is there any bit more that you want to share about your day-to-day? Has anything changed from the beginning to the mission to now?
From the beginning, we came in at a pretty bad spot. They were really in a bad spot with their staffing. They had one day they had at least 120 staff members out on quarantine.
Oh wow!
So we were just kind of slammed right from the get-go, doing several thousand pounds of laundry a day, cleaning tons and tons of rooms. Since then, we have seen the numbers go down of the sick staff, so it has gotten a little bit better. We see a little more relief from the hospital. Mm-hmm. And then also along with the vaccine getting administered, we see less and less sick staff members. So that's definitely...
Yeah, that's great. That's fantastic. So for those who may not know, how long has your team and you been providing support?
So we had 10 soldiers report the day after Thanksgiving. So we've been here for almost 6 weeks.
Oh, wow. Wow.
Yep.
So, and how much longer are you providing the support as of right now?
As of right now, we finish up this Friday, and then we'll start a 2-week quarantine period where we're going to go back to our homes and then stay in quarantine for 14 days, just to be sure that we're not, taking the virus back to our workplaces and things like that. So we'll be done this.
Oh, wow. Okay, perfect. So you recently received the COVID-19 vaccine.
Yes.
So when did you find out you would be receiving the vaccine?
So I found out on Monday, December 14th. They said that the staff was going to start getting their vaccines, and they said that we're not necessarily staff members, but because we're helping, they wanted to help us out and give us the vaccine. So I found out on Monday the 14th, and then I received it on Thursday, December 17th.
So what should people expect when they're getting the vaccine?
Definitely. I would say it's just like any other vaccine. You go in, they get your information. They give you a lot number, so you know which batch you got, which company's vaccine, and then just clean up your arm, and just like a flu shot.
Okay. So it hurt a little bit then, right? Just a little bit.
You won't like it.
Okay. So how did you feel after? Did you have any side effects at all?
I only had the sore arm. So the first few hours, nothing happened. And then for probably about 48 hours, my arm was pretty sore. I would say it's probably equivalent to like a tetanus shot.
Mm-hmm.
So 48 hours, but I had no other side effects.
Oh, okay. That's awesome. Since you've been, vaccinated, do you still have to wear a mask? I know that's a common question.
So the hospital policy and the state policy right now is wearing masks. As with all vaccines, none of them are 100% effective. Mm-hmm. So there's still a small chance that you could still contract it. So you want to be practicing that safety and always wearing a mask.
Okay, perfect. Good note for anyone that's watching this. So referencing the Wyoming Department of Health's website, we know right now that Wyoming is using a phase approach because of limited initial vaccine availability. And Wyoming is currently in distribution phase 1A, where healthcare workers involved in direct patient care and vulnerable residents of long-term care facilities are the first groups to receive the new vaccine. So do you have any final thoughts to share with those who await their turn for their shot?
Yeah, so as this pandemic kind of rages on, I would say that until you get that vaccine, you need to follow all the health and safety protocols, wearing your mask, social distancing, avoiding large gatherings. That's the only, effective way until you can get that shot to minimize this and get back to a normal life. Yeah.
Well, great information again for those who are watching, and we really appreciate you talking to us today, Sergeant Budwig. And thank you for sharing your experience with getting the vaccine. I mean, I know that a lot of people are waiting their turn to get it, so thank you for sharing that.
Definitely. You're welcome.
And if you are watching this and you have questions for us, or if you have questions for Staff Sergeant Budwig, please leave them in the comments and we will get an answer for you. All right. And thank you everyone for watching.